Hello, I'm Dr. Howard Strange of the Chiropractic Corporation here in Malden, Massachusetts. I'm here to give you a talk on health from a chiropractor's perspective. I know this is a little bit unusual for any doctor to give you a talk on health. However, chiropractors think of health a little bit differently than mainstream medicine. There's been a lot of talk in the media about healthcare as of late. There's a great deal of uncertainty and confusion. This is why that I'm giving this talk, is because I'm trying to clarify some of the confusion and try to provide some sort of certainty for our health in the future. There was a study that was done that indicated that we're going to be spending upwards of $100 billion per year on healthcare. The disturbing part of this particular statistic was that 75% of that is being spent on individuals, patients, who have less than 18 months to live. So basically we're spending much of this money on people with medication, with operations, with many, many trips to the doctor. And if they only have 18 months to live, then how effective is this health care? We don't have a healthcare crisis, we have a disease care crisis. Let's define exactly what health is. Okay, I have to refer to my chart. This is an ancient chart. You can tell by how crumpled up it is. Actually, it's just really old and it's been used a whole bunch of times. Health is defined as a state of optimal mental and physical and social well-being, and not merely the absence of disease or infirmity. This is taken from Dorland's Medical Dictionary, the dictionary that's used by all healthcare providers. Webster's Dictionary defines health as a condition of wholeness in which all the organs are functioning 100% of the time. In other words, every cell in your body is working in harmony with the cell next to it. What does it take in order for you to be healthy? So, well, we often describe these as 5 facets of health. Proper exercise, proper nutrition, proper rest, proper mental attitude or management of stress, and proper nerve supply. Now, I can talk for hours about these other individual facets of health, but the one I really want to speak about is proper nerve supply. Chiropractic is primarily dealing with your nervous system. Here we have life begins. You didn't know we were going to talk about sex, did you? All right, but basically we have a sperm and egg and it joins together. Then gradually the cell begins to divide a multitude of times until it forms this little black portion here. What this actually is the early part of our nervous system. What is the purpose of the nervous system? The purpose of the brain and nervous system is to control and coordinate the function of all tissues, organs, and systems of the body. And this is taken from Gray's Anatomy. Gray's Anatomy was actually a book, not a television show, right, that we had there. It was a big, thick book that we had to carry to class each and every day. If you didn't have a back problem before, you usually did afterwards from carrying this book. Okay, so now, let's talk a little bit more about the nervous system. My goodness, a polar bear in a snowstorm. Okay, here we have the brain and nervous system. Okay, up here is obviously the brain. This right here is the spinal cord that is attached to the brain, and this is part of the central nervous system. The central nervous system is probably the most important part of our body. In fact, this portion of our body, it's said there's evidence to support that this is the very same tissue that you had when you were born. Every other cell in our body is replaced usually about every 7 years. Okay, but this part here must be really important. That's why we have memory, right? So if it's so incredibly important, well, then it makes sense that we would have some sort of covering over it. Up here we have this skull, and down here is the spinal column. It's designed in order to be able to protect this very important part of our body. So now the brain is sending impulses down the spinal cord, okay, at the rate of about 400,000 impulses per second. It's a lot of bioelectric energy. And of course, this bioelectric energy is designed to be able to go out to control and coordinate the function of all tissues, organs, and systems of the body. But here it is. It's so totally contained in the skull and spinal column. How do these impulses get from the spinal cord out to all parts of the body? Well, we have nerves that come from the spinal cord, passing through little spaces between the bones, and these go out to all parts of the body. Just to give you an idea of exactly how much nerve we had in our body, we say that he has a lot of nerve. Well, oftentimes we underestimate exactly how much nervous tissue that we actually have. If you were to take all these nerves and stretch them out end to end, they would in fact go around the earth at the equator 2.5 times. If we were to take all the tissue here in my face and only leave the whatever nervous tissue there is, you still would be able to recognize my face as the way that it is. That's how much nervous tissue that we actually have. Where do all these nerves go to? Well, they go to every organ in our body. They're in the process here of telling our heart to beat. They tell our liver to filter out toxins. The same with the kidneys, our stomach to digest. All these individuals have some sort of nervous connection, and they allow our body to be able to work to its fullest capacity. Not listed here is also an immune system that will allow us to be able to fight most any disease, actually I should say pathogenic disease, that's out there. So the next question is that how then do we wind up getting sick? If all the nervous system is working the way it is intended to, well then how is it that we wind up getting sick? From a chiropractic perspective, the issue is subluxation. I define subluxation as a bone that's out of place that's irritating some nerves. This is a picture that I'm told was actually taken from a medical book, medical textbook. These right here are individual vertebrae that are stacked one on top of the other. Here we have one main vertebrae. Now in between each of the vertebrae are vertebral discs. The discs act as sort of a cushion between the vertebrae to allow us to be able to have movement. They also act as a shock absorber to prevent us from breaking the bones all the time. They also act as a means of separation between the vertebrae to allow us to have these holes right here that you can't really see, but this right here is actually a nerve. Okay? You see how big and nice and how thick and juicy that nerve really is. There are impulses coming from here, and these are going out to all parts of the body, or various parts of the body. This vertebrae right here, you can see that it's not in its proper alignment. You can see that it's moved posterior. Okay, it's moved towards the back. Okay? As a result, this nerve right here, kind of wimpy. It isn't allowing there to be as much of the impulse or all the impulses that you would normally get as you would from the nice, thick, juicy nerve. Okay? So, anyway, so what we would do is, chiropractic do is we would find this vertebrae that is misaligned, all right, out of place, and find a way to put it back into its proper alignment, thus allowing this nerve to wind up getting its full amount of bioelectric energy and all the nerves to work the way they're supposed to and allow the body to heal itself. I do want to emphasize, this is a graphic depiction. Were this to be a true depiction of the nervous system, well, this would be such excruciating pain that you would definitely die. This is where we come to chiropractic adjustments. Our primary purpose is to remove the vertebral subluxations, to free up the nerves and allow the body to heal itself naturally. Naturally is free of drugs, free of any kind of medication, free of surgery. We are a surgical and medication-free alternative to healing overall. Now, there are always 4 phases of care that we have. Okay. First of all, we always want to eliminate your pain. Every doctor wants to eliminate your pain. But then we also want to make a spinal correction. Just because we eliminate the pain doesn't mean that the vertebrae aren't susceptible to moving back out of place and interfering with the nerves, even though your pain may have gone away. Too often we tend to think that, well, the pain is gone, therefore I'm healthy. However, I'm here to tell you that the pain is the last thing that appears when you have a subluxation. Very often the subluxation has been there 2, 3, 4 years ahead of time before it suddenly becomes symptomatic. Doesn't it make sense that it would take some time in order for it to get back into its proper alignment and allow it to be able to prevent, allow it to be able to work to its full capacity once again? So, we want to make a spinal correction. We want to maintain your health. What sense does it make to have your car completely tuned up, right, and never maintain it ever again? What sense does it make to have your teeth fully cleaned and then never do it again? It doesn't really make a whole lot of sense. So we want to be able to maintain your health and ultimately prevent dis-ease. Dis-ease was first coined by B.J. Palmer, which refers to dis-ease as being lack of ease. I'm Dr. Howard Stranger of the Chiropractic Corporation here in Malden, Massachusetts. If you have any questions or comments, please feel free to contact me. Thank you for watching my video.